Hello, this is Dr. Jerry Williams from Urgent Care 24/7, coming to you today from beautiful Athens, Georgia, home of Bulldog Urgent Care, which is one of our urgent care lines that we have. We are here today to talk to you a little bit about acne. And I just want to talk about generalities about acne. First of all, acne is a condition where the pores of your skin get blocked with oil and dead skin cells or with dirt, and it causes inflammation and other kinds of lesions. And I want to kind of run down a list of the lesions, and I want to make sure I don't leave any off here. So I'm going to refer to my notes. It causes whiteheads, which are closed, plugged pores, blackheads, which are open, plugged pores, papules, which are small, red, tender bumps, pustules or pimples, which are papules with pus at their tips, and then nodules, which are large, solid, painful lumps under the skin. And then the most severe are the cystic lesions, which are painful, pus-filled lumps under the skin. Now, acne tends to affect teenagers and young adults the most, though it can affect people at any age. And in women, it typically flares the week before menstruation. The earlier you can treat acne and catch those pores that are clogged earlier and get them cleared and cleaned, and treat any infections earlier, the easier it is to treat, because it doesn't get as severe as all infections. As you've heard me talk about other infections before, important to get treated early and get a thorough, effective treatment early. But also important that if you catch these early, it's less likely to scar, which is a big deal, because acne in patients who are affected with acne, especially severe like cystic acne, the scarring and the pain and frankly, patients are very self-conscious and frequently embarrassed by their acne. It can be very emotionally distressing to them. So catching it early is really important. So if you're suffering from acne, really important that you seek medical attention and from your primary care provider, whether it's a physician, nurse practitioner, or PA. And if it's severe enough and you don't respond to routine measures, to get in with a dermatologist as quickly as possible. Very important that you follow their guidelines in cleaning the skin thoroughly and routinely, and any medications, either topical or medications to take by mouth, or injections, which are unusual but can happen, it's important that you follow those recommendations daily. Now, one of the things that we see in the urgent care setting is patients who have episodic acne, where they'll have an outbreak and it'll get bad, and they come in, and typically those are treated with minocycline or doxycycline, which are tetracyclines, which are typically very effective. We also can use topical medications as well. Also, there are medications that you can be given if you have severe acne that actually prevent the acne. So very important that you check with your primary care physician or primary care provider and or dermatologist to see if you're an appropriate candidate, if your acne is severe enough to warrant medications that are preventative. A lot of the problems that people have with acne can be solved with thorough, careful cleaning of the skin and management of exfoliating and cleaning the oils off of the skin can really make a big difference, but not in all cases. And clearly some people need additional treatment. So that's why I'm encouraging you to get seen early before it gets bad and get on the proper treatment protocol. So I appreciate you listening in today on a quick chat about acne. And if you're suffering from any of those symptoms, or you or a loved one, please go see your medical provider quickly. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.